Hello, Nish here. I want to talk a little bit about medications, prescriptions, stuff like that, that will help you to feel your best during and after surgery, top surgery. So, firstly, we have bromelain, right? And we got arnica. Now, these two things here, this one helps with inflammatory response, and this one helps reduce bruising, swelling, and pain from soft tissue damage caused by surgery. Now, Dr. Garamoni's office recommended these, and I strongly suggest that you spend the extra about 60 bucks and get them because I find that they are very helpful, and I think they really helped me recover from top surgery very quickly. So, we got these two. Also, we got antibiotics. Very critical. We have to take these from the day after surgery all the way to the end of the bottle, right? In addition to this, you also get some narcotics. You know, trying to remember what was the name of my narcotics again?
You had
I'm sorry, I'm trying
oxycodone.
Oxycodone, right? So, I had some really good drugs, and I was very grateful for them. I didn't take them. They were supposed to take them every 4 hours as needed, twice, two tablets, every 4 hours. However, 1 to 2. But for me, I tried to take one, and if I felt that the pain was too much, then maybe an hour later I'll take the second one. But on average, I really took one tablet as much as possible. But I finished the entire bottle though over the course of about 2 weeks, less than 2 weeks after top surgery. About a week, yeah, about a week after top surgery. And that really helped me to, sleep, rest well, because rest is also important. So what would actually wake me up in the middle of the night was the pain. And that's when I would take my medication, right? So try to take it on schedule as well, so that your body, don't just feel that intense level of pain. Cool. So that's for me. I didn't actually need Benadryl and my medication for nausea. I didn't feel nauseous. I was pretty good. But again, when you go to fill a prescription, definitely fill everything that you need, so that when the situation arises and you need it, it's right there for you. One other thing though, you're gonna be constipated, right? Let's talk about constipation. So, recommendation for me, I had prunes. So I started eating prunes days before surgery. So that after surgery, I would continue eating my prunes, and that will help me to have a bowel movement. I think I had bowel movement maybe 2 days after surgery, which was not bad. And hear that some people really have an issue with constipation. I didn't feel bloated. Additionally, I had papaya and pineapple and yogurt, and those things really help. My partner is telling me something here that I'm probably forgetting.
Yes, you're forgetting the very essential probiotics.
Probiotics. All right.
Yes.
So probiotics. My partner talked to Dr. Garamoni about me taking probiotics, and he was like, "Yeah, that's really great, because you're not really supposed to take like vitamins, because it has like vitamin E and other things in it that don't really help your healing process. So probiotics is awesome. Definitely recommend that you add that to your post-op care regime, and so that's pretty good. One other thing, this little guy here. Because when you have surgery, right, your chest is pretty compressed and tight. So, this tool helped me to ensure that my chest expanded, to increase oxygen in your chest and blood flow. And you try to get, at first when I started, I could only get the first ball up. Not even all the way up. It was barely going up. And it's supposed to be done about every hour, or maybe let's say every couple hours, right? As needed. And if you feel lightheaded, just stop. But just take your time, you blow, and you try to get all three balls up, just to show that your lungs is back to your normal capacity. So those are some of the things you need to do post-op. Also, compression socks. Now you're going to be in bed for most of the time. While your feet may be elevated, compression socks also help, so that you don't have any blood clots, right? So very important. It's very cheap, but don't skimp on little expenses like that. Get your compression socks, put them on after surgery, and try to move around. When you're not moving around in bed, you wear compression socks. If you have to travel after surgery to go back home, wear your compression socks on the flight, even if it's a hour flight or 2 hour flight, things like that. So I hope these tips help. If you have any questions, drop me a line.